Okay, the meeting is live and you're recording.
We're going to give it a couple more minutes because it's our time. Like 65 for lunch. In the meantime, Mark, can you elevate?
She's already elevated. Yep, doing it now. All right, so they both are be panelists. Oh.
Hi guys from DoHMH, thanks for being here and thanks for the invitation. I'm just going to give it a couple more minutes before we start. 6:32. I think so. I mean, if you want, you can also just accept. All right. I just not on the Zoom. No, I know that. I wonder if she's on Zoom.
Good evening. Just checking my
I don't see her
audio
either.
and video.
And who is that face on my screen? I don't see your name on your.
It's Martha.
Oh, you're Martha. Hi, Martha.
Hi.
Hi,
I can.
muted, but that's okay. You can see muted.
Can you all hear me?
Oh, okay. Well, yeah, I can't hear you. So
Great.
unmute yourself and see if you can say something. You disappeared, Martha. Maybe you're coming back.
Your audio is a little bit muffled on my end. I'm not sure if it's just me or anybody else. This is Martha.
Well, this is like one time data point. So, Pauline, you can probably hear me. We're just waiting at this point, I think, for Martha to join again, and then we'll start. But I don't see Martha. Who's underneath Angela? Got it. Okay. Martha, if you're with us, do you mind unmuting yourself and just saying 2 words so that we know you're with us?
Hi, everyone. Martha Vernaza from. Can you all hear me?
You can hear me, right? Thumbs up. Can you hear me? Okay, but we can't hear you. So hold on a second. You can hear us kind of, right? Okay, so we're working because we have to get your audio to come into output. Our audio is coming to you, right? Thumbs up or thumbs down? Muffled. Not good.
Trying.
Okay,
Keep trying. Keep trying.
Keep trying.
Can hear the gentleman just fine. It might be the microphone.
Okay, we had this problem before.
Any better? No. This mic is not better, right, Martha? Nope. Okay. Fantastic. The speaker next to the channel.
That's where the sound should come from. No, I can use the owl instead, especially with a room this small. But it's supposed to come through this board and go to that. No, it's the microphone, not the speaker. No, the owl is turned off. I sound great. Oh, is that? No, but the sound from the laptop is coming from your microphones. Oh, give me 1 second. I'm sorry, because I did something incredibly.
It's not stupid, it's just technology. I don't know. Is this any better? The panelists, but that was a message from 2 seconds ago. So let's see, any better now? Someone give me a sign. Now I don't even see
Great.
anybody.
That sounds great. Can you all hear me?
Okay. So now, Martha, can you talk? See if we hear you, because I don't see you.
My
Oh.
video is up. Can you all hear me now?
Okay, I can hear you poorly. Count to the 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, if you can you boost that any more, Mark? Try count to 10.
1, 2, 3, 4, 5, 6. Great.
Okay.
Good. Thank you so much.
Thank you very much. Thank you all for your patience in this. Pauline, I'm assuming that the people from DoHMH who are presenting are Martha and maybe Angela? Or is it just Martha from DoHMH?
Right, so it's Martha, Pauline, Angela, and Christine, who's also Martha on the screen. She's
I don't know
Okay,
why
and
it
I don't
says
see anybody's
Martha.
name at all. Oh, I see they're on the, okay, they're on the computer, but not. All right, I'll tell you what, why don't you guys talk to us? No, let me start from the beginning. I've welcomed everybody. I'm now going to welcome our committee, and I'm going to tell everybody, since this is being recorded, what our agenda is tonight. We have 2 agenda items. We're going to talk to the Department of Health and Mental Hygiene of New York City, which wants to talk to us about rat abatement. And then we're going to meet with are you the president? The vice president of Northwell Greenwich Hospital, to hear about new services that are here. And also I had a lot of questions about the impact of the closure of Beth Israel on this facility. So let's introduce our committee members, and then we will introduce our panelists, and we'll take it from there. So I am Susanna Aaron. I'm the chair of this committee.
Janet Liff, just a member.
Rachel Yarmolinsky, public member.
Amanda is full board member and committee member.
Juliet Kay, I'm a member. And we don't have a quorum tonight. We're still going to get all the information from these 2 topics. Okay, now can you guys introduce yourselves? And then we'll ask you to launch into your presentation.
Good evening, everyone. My name is Martha Vernaza. I am with the New York City Health Department Pest Control Services. I lead our outreach and education team. We are here with Christine, who can introduce herself and maybe pass it on to our next health department staff.
Hi, everyone. My name is Christine Gargano. I am the case manager for CB2 for Pest Control Services. So I do inspections and outreach with the community. Thank you.
Anyone else from DoHMH?
Hi, I'm Angela Stravis. I'm the supervisor for the Lower Manhattan team for the neighborhood rat reduction. program.
Okay, and your camera's off. That's why I don't see you. And I know that Pauline Ferrante is here as well, but you tell me, Pauline, that you're here just as an
Hi,
observer.
it's Pauline.
Oh. Pauline, just give us your name and your title.
Pauline Ferranti, Manhattan Community Liaison in the Office of External Affairs at the DoHMH.
Terrific. And now I see you've shared your screen and you should go ahead and begin your presentation. Martha, we don't hear you. Martha, can you hear us? Okay, you need to unmute yourself.
Sorry, I went off on mute.
Okay.
But we're okay now.
Start over.
Thank you all so much for having us. So I'll talk about what the New York City Health Department Pest Control Program is doing in Community Board 2. But in general, the Pest Control Program enforces the New York City Health Code Article 151.02, which indicates that property owners are responsible for keeping properties clean and free of pests. We promote healthy and safe environment for New Yorkers. We perform outreach and compliance. So we have proactive rat inspections in areas with highest burden of rat activity. Manhattan Community Board 2, within Manhattan Community Board 2, there are 2 areas where proactive rat inspections are happening, and I'll get into those. So when these properties are inspected and failed, the property owner on record will receive a commissioner's order and information so that they can move towards compliance steps and correcting the health code violations. Following a commissioner's order and following a failed initial inspection, our inspectors will come out for a compliance visit to ensure that the health code violations have been corrected. If they have not, at the compliance inspection, the property owner on record is then issued a summons. I'll go into those more into depth, but that's just our inspection cycle. So at the Office of Pest Control Services, we promote we conduct pest management activities. We prevent the transmission of rodent-borne diseases, prevent rodent bites, and our aim is to improve the quality of life for New York City residents by reducing rodent populations. Our focus is rats. So we respond to complaints from the public, both 311 complaints and complaints received from elected officials, community boards, the general public to our mailbox. But we respond to complaints from the public. We conduct those proactive inspections on public properties, so city-owned and managed properties, as well as private properties. We publicize best practices for rodent management, so we have a boatload of resources in many different languages. We teach Rat Academy, which is a rat prevention and management training. We go out to health fairs with our printed materials, community block parties, community events. We promote pest management by pest control professionals. So we do have exterminators on staff who are summoned to treat when property owners fail to do so. We also share our inspection data through the New York City Rat Information Portal found on our website, nyc.gov/rats. And we work with the New York City's with City Hall's Director of Rodent Mitigation, the New York City Rat Czar, and we collaborate with our sister agencies. So NYCHA, the New York City Housing Authority, Department of Education now, New York City Public Schools, Transportation, Sanitation. So we collaborate with our sister agencies to work towards management and prevention of the rats. So in the New York City, at the New York City Health Department, we have identified rat mitigation zones and rat reservoirs. In our rat mitigation zone and reservoir areas, inspectors conduct proactive inspections. Also in these areas, we have case managers and case manager supervisors. Christine on the call is one of our case managers for the community board 2 area. And she's very familiar with these areas within the rat mitigation zones.
Sorry, can I
Case,
just interrupt
yes.
a second? Can you tell me what a rat reservoir is?
So rat reservoirs and rat mitigation zones are those areas that have been identified to have higher burden of rat activity. So they are areas that we have highlighted and areas that receive this additional support with case managers and additional collaboration with those sister agencies. So in these rat reservoirs, in these rat mitigation zones, in these identified areas with high burden of rat activity, we have case managers who do walkthroughs and provide one-on-one guidance towards compliance steps. They work very closely with property owners. Christine works very closely in community board 2 with property owners, property managers, supers. And again,
So you
also
don't
with
actually provide rat abatement yourselves. You don't actually provide pest control services.
when the health department treats a property, it is when the property owner fails to do so, because it is the responsibility of the property owner. When the health department steps in and sends in exterminators for treatment or abatement, it is at the expense of the property owner. And it is it occurs when when our case managers see that the property owner is not taking the steps towards remediation. So the health department steps in with our own extermination staff.
And this includes tree pits that are on the sidewalk. Is that correct?
Yes, so tree pits in the rat mitigation zones and reservoirs are receiving stoppage services. Stoppage services is when the health department staff, the stoppage team comes out and fills burrows in tree pits, fills a structural areas around the tree pit, the structural areas around the tree pit. We fill those. We do like a layering method to plug and get rid of the burrows in the tree pits.
And you charge the property owners for that?
Not for the tree pits, no.
Not for the tree pits. Okay, yeah. Turn that one on.
Martha, just on that image, is there a difference between the rat mitigation zones and the rat reservoirs? And if so, what is that difference? And then here in this image, I'm guessing the blue areas are the identified zones or reservoirs. And if there is a difference, how would we see them here?
So the rat mitigation zones are just larger areas, and the reservoirs happen to be just smaller areas within those areas that are identified to have the higher burden of rat activity. So I will show you in maybe this map. These maps are a little bit better. So
online too, or you'll share them
yes,
with me?
they can be found online. The rat mitigation zones can be found online and our website if you want more information specifically on those. But so the purple is the reservoir, I'm sorry, the rat mitigation zone, and the blue, the lighter blue are our reservoirs. So this here is a map of Community Board 2. So Community Board 2 as a whole has 4,731 tax lots.
Martha?
Yes.
Actually CB2, there's no mitigation zone in CB2. There's a couple of blocks in CB2. The main mitigation is in CB3 in Manhattan.
So these reservoirs are not in CB2, the Greenwich Village and West Village reservoirs?
Yes, those are reservoirs. CB2 has reservoirs, main reservoirs. Right.
Got it. Thank you, Angela. Thank you for clarifying. So within
So a
CB2,
reservoir, sorry, a reservoir is an air, it's a place. It's a place with a concentration of rats in a larger, it's a subset of a larger rat mitigation zone, right?
so reservoirs happen to just be smaller areas, and the rat mitigation zones are larger. They don't necessarily, they do not fall within each other, but the reservoirs in the case of Community Board 2 fall into Community Board 2.
Okay, and in both cases, the rat mitigation zones and the rat reservoirs, the interventions that the city is doing is on inspections and what you say, case management and something else that you said, but not actual treatment, except for in the tree pits. I'm confused about where the city is actually putting out pesticide services.
So we are treating both inside rat mitigation zones, outside rat mitigation zones. The health department, if our inspector deems it necessary to treat because the property owner is failing to do so, treatment will be sent to the property, to the tree pit. When the property owner fails to do so, to the private property, when it is necessary, deemed necessary by the inspector in the tree pit, by the Department of Health. When the Department of Health treats a private property, it is at the expense of the property owner. When the Department of Health treats a tree pit, it is not at the expense of the property owner.
Okay, that is an important distinction. I'm going to let you complete your presentation. I'm sorry, I don't mean to interrupt you too much.
Thank you, no
I have
problem.
a bunch of questions, but I'll let you.
It's perfectly fine. So this is Community Board 2 as a whole. In calendar year 2024, there were 5,062 initial inspections conducted. 9% of those inspections failed. So again, our failed initial inspections are followed by compliance inspections, which is when we come back to follow up to check whether the violations have been corrected. In calendar year 2024, 60% of those compliance inspections failed. So of 613, 320 of those failed. And Susanna, I will be sharing these slides with you all in case you want to review and come back with additional questions. That's perfectly okay also. So I will be sharing this information with you all.
Great, thank you. That's very helpful.
So this is one of our reservoirs within Community Board 2. This is our Greenwich Village reservoir.
Can you tell me
within I'm sorry.
Are the boundaries clear? Okay, sorry, I'll turn around and then I can sit. Sorry, go ahead. Sorry.
So it's 7th and between 7th and Worcester, and then West Houston, and is that Watts? Yeah, Watts. So there's 631 lots in this reservoir. 8% of those lots failed. And then again, these lots are case managed by Christine, who is on the line, and also Angela, who supervises this reservoir. Now there's the West Village Reservoir also within Community Board 2. There's 918 lots in this reservoir. 9% of those failed in calendar year 2024. And again, same case manager, same supervisor. When there are concerns, questions, comments that property owners, property managers, even just residents have within these areas, we ask that their main point of contact be the case manager for the area, who is familiar, visits regularly, and can provide up-to-date regular information on what's going on. Christina is very familiar with specific properties, so it's important that you all know that there is a contact for this area. There is a person to go to when you all receive complaints, concerns, inquiries.
I have a bunch of questions, but tell me how many more slides you have so that I know how to pace.
I have about 6.
6 more slides?
Yeah.
Let's try to work with them kind of quickly so that we can move on to the agenda item.
Yeah.
as well.
So I went over our inspection process, but again, an initial inspection, when failed, we come back for a follow-up inspection. A property will fail an inspection when there are live rats, droppings, burrows, when there are signs of rats on the property, or also when there are conditions that rats favor on the property at the time of the inspection. So these are reasons why properties will fail. These are what's in the CODA. The commissioner's order is an inspection report. It provides the property owner information about having time to remediate. It provides our contact information. It also lets them know that we will be coming back for that follow-up inspection. So that follow-up inspection, if failed, the property owner is summoned to, it receives a summons to the Office of Administrative Tribunal and Hearings, or the oath office. Oath will then assess fines, and fines go from $300 to $2,000. So these are just some of the things that property owners are recommended to do to pass inspections, to prevent and manage. So cleaning is important.
The whole list. What I'll do is I'll incorporate those into a report.
Sure. So these will be coming to you. We do welcome community groups to invite us to community events, health fairs, to your cleanup events. Also, we do schedule walkthroughs, which is where we walk with the case manager through the impacted area or the area of concern with the people in the neighborhood or block. We have Rat Academy, which is our free rat prevention and management training. We often raffle the new NYC bins at our Rat Academies. This is our rat information portal. This is our map where you can go nyc.gov/rats. You can do property research, look up properties to see what is happening in terms of rat inspections. So you're able to see if a property has been inspected within the past 6 months. You're able to see if the property passed, failed, or failed for other. Which would be, again, those conditions conducive to rat activity. Our website also has that information on those rat mitigation zones and reservoirs, and definitely a lot of resources. Reporting to 311 is recommended when there is a concern about rats on a particular property. Providing as much information as possible is important for our inspectors for gaining access or just more information about the concern. We have Preventing Rats on Your Property guides in multiple languages. These are orderable by calling 311 or by request to our email box. They're also available again on our website. We have some posters. We are on social media, and that is the end of my presentation. I will take any and all questions. I'm sorry, I was rushing through.
Thank you. That's great. Does anyone on our committee have a question?
Okay, I'm sorry I came late. Okay, I'm Keenberger, I'm a member. And did I miss why rats are a problem? Because I personally, I'm a psychologist, we have rats for pets. Sometimes, I mean, I'm astonished at all this. And I wonder, a rat's what I missed, was that part of the presentation? Well, I would like to know.
So rats,
Rats are a health hazard if they are.
yeah, rats are a nuisance. They can be a public health hazards in areas where there is more concentration of people. So denser areas are areas where more garbage is produced, more people, more garbage, the more opportunity for rats to feed. So where we are seeing these high concentration of rat complaints and rat activity is where we are offering these case management services and paying closer attention to these areas.
I think that Keen is asking a more basic question, which is what's so bad about rats? Is that what? Boy, that's a minority opinion, but so the question, I guess, is what are the health hazards of rats?
Well, rats can carry diseases, leptospirosis. Rats, can alter your mental health, right? If you're living amongst them. So they are definitely considered a pest, and definitely something that the health department has had a focus on, I think, for very many years, many different administrations.
I can look at the site, but can you tell us how we compare to other community boards?
So I think the best way to maybe take a look at other areas is visiting our map. So our map, I'm not sure if you can see my pointer, but you can turn on the toggle on the map, and then you can visit different community boards, different areas within the 5 boroughs where you can see lots of pink, lots of failed. Our green is passed, our purple is failed for other. So you can definitely take a trip around all of the different community boards and get a good visual on rat inspections if you visit our rat information portal. That might be the best way to take a look and compare.
Thank you. So I am in the Greenwich Village Reservoir, or whatever it's called, and I was visited by an inspector, and I was sent a letter that warned me that if I did not take care of my rat problem, I would be charged for you guys mitigating for it. So my house, just so it's a house on West 10th Street. There are restaurants all up and down the street. Outdoor dining just began up again on April 1st. I have 2 bins. They are DSNY issued bins, one for composting, one for garbage. They both snap shut. And I have a tree pit in front of my house on which I've spent thousands and thousands of dollars to get the rats out of there. So the inspector comes and sees droppings around my garbage, and I am issued a violation. So my question is, the time and the money that is being spent, I'm a perfectly law-abiding citizen. I mean, I am doing exactly what I'm supposed to be doing, and I'm paying my own money for to get rats out of the tree pit. I have not seen anybody from DoHMH coming and actually treating the tree pits. And if this inspector thinks that I have a rat problem, I'd like to know what he thinks the source of my rat problem would be, because it's going to either be my tree pit or the restaurants down the street, because otherwise I am a concrete building with a concrete sidewalk. So I guess my question is, are you guys spending any money on actually doing mitigation yourselves instead of just inspecting and sending violations to property owners? Isn't it possible that the property owners are not necessarily responsible? Sorry,
So we are treating tree pits. maybe Christine, you could speak a little bit about the work if you're familiar with West 10th Street.
I don't want to, make you talk about my experience. We could do that offline. I guess it's just as a general question, are you guys going up and down the streets and treating tree pits? Because that's going to be the source of where the rats burrow throughout the Greenwich Village district at least, and I don't know about others.
So as our inspectors are out proactively inspecting the reservoirs or just out on their inspections in general, they are also picking up. And by picking up, I mean taking note, creating tickets for tree pits. They're also creating tickets for oh, I can't think of the sewer on the corner. I can't think of the names right now.
When you say
Catch
tickets, do you
basins?
mean
The catch basins, yes. So we are.
When you say tickets, do you mean summonses or do you mean work
No,
orders?
I mean work orders, correct. So we are creating work orders for those tree pits when we are seeing rat activity in the tree pits. We are creating work orders when we see rat activity in the catch basins. So unfortunately, our stoppage team, our extermination team are not the largest. So those tickets don't always expedite as fast as we would like. But we are taking note of those areas and we are creating those work tickets for them.
Right, and before I cease to monopolize this, I just want one thing. Do you know anything about the budgets? How much money you're spending on actual exterminators and how much you're spending on public awareness or any other departments?
I don't know about the budgets, but we can definitely look into that information and send it to you by way of Pauline.
Thank you. I would appreciate that. Sorry, Arturo.
Yes.
Yeah, I had some follow-up questions. I have two questions, actually. If you could touch on a little bit about parks and construction. I think more generally, how do you tackle that? Do you work with other agencies? And same thing for construction. And then the second question is, are you tracking the impact of outdoor dining? Because the last time that we had outdoor dining, a lot of our neighborhood was affected by rats, rat sheds is what some people have called it. And so how do you plan to take into account the reopening of outdoor dining and making sure our neighborhoods are aware of the impacts of that?
Great. Those are great questions. So as I mentioned earlier, the health department also inspect city-owned and managed properties. So we are surveying parks as well as schools, as well as New York City Housing Authority. When we do inspect city-owned properties, in your question, when we do inspect parks and this park fails for rat activity, what we do is we send a referral to the Department of Parks and Recreation. The Department of Parks is then required to remediate and send the Department of Health back a remediation report.
Thank you so much. Does that answer your questions? Oh,
no, that was part one. So part two with construction. So construction sites, depending on the type of site, if it's a brand new construction site, they are expected to hire a pest management company to treat while they are working on construction. With construction sites, oftentimes construction sites, they live for a very long time. They live abandoned for a very long time, closed off for a very long time. People dump into construction sites. So sometimes construction sites are providing this ideal habitat for rats, but construction sites are also reportable to 311. And construction sites are also inspected by our health department inspectors, if accessible, right? If they get a peek through a hole, or if they're able to see the rat activity, they can definitely inspect and assess. And then with outdoor dining, there are new dining out rules, and there are new dining out structures that businesses are supposed to follow certain rules about the dining structures. We did work collaboratively with the Department of Transportation to ensure that the new structures are taking into account the pest concerns. And I think you can find more information on that at Dining Out NYC.
Yeah, I sit on the outdoor dining working group, so I'm familiar with the recommendations that are being given on roadway cafes. My question is also kind of a request, which is it'd be great to keep track temporally of what you're seeing in terms of like rat activity in the neighborhood, given that outdoor dining is becoming a thing, that we have a lot of roadway cafes, and it'd be important to see the impact of that on the rat population.
I think, Angela, maybe you can clarify on inspections when they come have to do with outdoor dining. I'm not sure if there is an inspection process with outdoor dining and the new dining out structures.
There's nothing really changes on our side when it comes to inspecting restaurants, outdoor dining. We continue to inspect for rat signs, and if there's rat signs around the structure itself, we still fail it. But then the violations go to the property owner itself, not the restaurant. So when it comes to a restaurant, it's going to be probably for Food Safety Bureau. Yeah, but I don't know if DOT has another hired more inspectors for that part.
Martha, is it okay if I just add something?
Yes, of course.
Again, I'm the case manager in this area, and if you guys have any further questions, just let us know. But we are noting the outdoor dining being built in CB2. I have been noting it for the past few weeks. I do see it happening. And if it's not being built correctly, I have been trying to let them know as they're building it that there is an updated protocol that they have to follow. You can also say to 311 if you're noticing that these outdoor dining structures are creating a nuisance for rodents. And then from there forth, we go to the restaurant and we try to talk to them. So yes, I definitely have seen them being built, and I'm sure you all have as well. Walking down the street, you see them. But we're trying to do outreach at this time because DOT is kind of primarily in charge of the outdoor dining, but since we're working with them, we try to make note also.
Well, thank you guys very much for this presentation, and thank you also for doing what is a Sisyphean task in the city. We'll keep you posted. Thank you very much.
Thank you all.
And sorry, no. Bye, guys.
Goodbye. Good night.
Okay, so now we're going to move on to our next topic, which we have Tracy Feiertag here. Tracy, why don't you come on up and I will go to the side. A lot of feedback. So. Okay, I'm going to ask our next guest to introduce herself, and then I'm going to tell you something about her. Okay, Tracy, go ahead.
Hi, my name is Tracy Feiertag. I'm the Vice President of Northwell Greenwich Village Hospital, which is the hospital that we're in right now. This way. Okay, this way I don't have to really look at myself.
Okay, now, this is what you all have to know about Tracy, is that she is one of the country's top darts players. So just tell us 2 minutes on that, okay? Because it's just very cool.
Yes, I've been playing professional darts for 20 years. Right now, I'm number 2 in the country for women and number 10 in the world.
I just thought you had to know that. So thanks for your time here.
It's a good place.
Right here in the neighborhood, Flannery's is one of the biggest dart bars. You can go in there, there's about 6 boards that you could play on.
All right, so we're here tonight for Northwell Greenwich Village Hospital, which has just changed its name from Lennox Health Greenwich Village, was interested in meeting with the community board to let us know some of new services that you're bringing online and what this means for the facility and essentially why you changed the name. So tell us a little bit about that.
Sure. So Northwell has been in this building for 10 years. We're actually about to hit our 11th year. When we first opened in 2014, we had a freestanding emergency department, a satellite emergency department as part of Lennox Hill Hospital. And that was the only service that we offered in the building. And this was all as a response to the closure of St. Vincent's Hospital, where this used to be the O'Toole building, the outpatient building. So over the years, we've been conducting listening tours. And at the beginning, there was a community needs assessment. And what we've done over the past 10 years is continued to add services to the building that the community needed. And those services included outpatient imaging, things like X-ray, CT, MRI, mammography, ultrasound, bone density. We have outpatient surgery. So if you need to have a surgical procedure but don't need to be inside the hospital, we have that. Mostly we do orthopedics and GI, like colonoscopy and endoscopy. And we have physician practices in the building as well. So many multi-specialty physician practices. Northwell has also built a significant network of outpatient practices in the downtown area. So that's where we were at. We were prior to COVID, starting to think about what the next services that were needed were, and the decision was made to request from the state approval to open up a cardiac catheterization lab. And we will also be opening an inpatient unit. And so with the adding of these the expanded inpatient unit and cath lab, we decided that we are at this point considered a hospital. Some would call it a micro hospital. So we are still part of Lennox Hill Hospital. We are on their operating certificate, part of the same Article 28 license, and we are finished with construction, going through the process. Those services will be open early this summer. And because of the added new services, we wanted to be recognized as a hospital. And so we also wanted to make sure that the community was aware of actually what we are. With the name Lennox Health Greenwich Village, it doesn't actually say what we are. And I think that was confusing to people. We want to make sure that the community is aware that these services are available. And by calling it a hospital, it's more understandable.
So what, if I'm calling an ambulance, what things will they take me here for and what things will they not take me here for? With this new additional services?
So once we have the service in place, they will take you here for anything with the exception of the following. If it is a purely a behavioral health issue, you will not be brought here. We also don't do trauma. So if you have a stroke, trauma, so behavioral health is a mental health issue, a mental health emergency. And trauma would be if you were in a bad car accident or you fell down a flight of stairs, things that would normally require immediate emergency surgery. Gunshot wound, stabbing. It doesn't actually mean that they won't ever take you here, because sometimes, if it happens literally right outside, they'll sometimes bring, because our fully capable to do stabilization. But we will be accepting heart attack patients and stroke patients as well. Correct. Correct.
Our patients and stroke patients normally would not have been brought here, but you're saying that once this facility is up and running in the next month or so, now a heart attack patient could come here.
Correct.
And a stroke patient could come here.
So those patients can come here now, but the ambulance wouldn't bring them here. So if you are walking down the street and you have a heart attack, you can come here, but we're on diversion for those things right now, which means the ambulance wouldn't bring you here.
And you're on diversion for behavioral health and will remain on diversion for behavioral health
And
for
trauma.
trauma. And what about peds? I think you told me once that pediatrics is also another area.
So they will try, so emergency peds, so, you know, we still treat a lot of pediatrics here, and ambulances will bring in pediatric patients that aren't, critical. So it's critical peds that we're on diversion for.
And anything else?
No.
So I want to invite people to raise your hand to ask questions. Beth Israel's closing, and of these things, I mean, so for example, Beth Israel's closing, they accepted behavioral health cases. You do not and will not. So that is a gap, right? We will have that gap
For ambulances, yeah.
for ambulances.
We still treat a fair amount of behavioral health, of mental health emergencies through walk-ins.
Oh, can you share with us a little bit more about that, about walk-ins cases that might not come to you by ambulance, but that would come in with a walk-in?
Any kind of case.
Any case, because if anyone walks in, you're going to take them and you're going to figure out where to send them if you need to send them.
Correct.
Or to stabilize them or to
Yep.
treat them.
And we say stabilize and transfer.
The other, I mean, I don't know if I want to launch right into the question of Beth Israel's closures, but do you want to ask any questions about the existing services? Yeah, Arturo, why don't you go?
All right. I mean, I maybe want to take a step back and even like look at it from the point of when a person makes a 911 call because they're sick. How does that work in terms of that operator allocating an ambulance and then sending them either like here or to another place? Does that depend on the diversion and the folks that you're willing to accept? Is there a part of it? Is it based on location? I'm just a little bit more curious about that.
Yeah, and I was planning to speak to a little bit about a change in the FIDNY policy on EMS.
FIDNY being the fire department.
The fire department, who runs the 911 system and the EMS system in New York City. So if you call 911, they will dispatch an ambulance. The ambulance might be operated by FIDNY. It might also be operated by one of the health systems. So you'll see ambulances with Mount Sinai, NYP, NYU, Northwell. Those health systems help support the 911 system. And so we pay to have ambulances out there in the community to help support FIDNY. So if you call 911, up until recently, they will take you to the most appropriate hospital, and they would take you to the hospital of your choice within reason. And there wasn't a lot of definition around within reason. So you could say, I would like to go, if you were, you live in this neighborhood right here, but you wanted to go to NYU, they may take you to NYU. No, even if it's a Northwell ambulance or a Mount Sinai ambulance.
And who do you request that to?
To the driver.
To the driver.
So in March, there was a policy change with the fire department on their 911 receiving because they were concerned about their turnaround time, getting ambulances back onto the streets to be able to get to the next call. So they said, driving people to the hospital of their choice is taking too long. And so from now on, it's the closest appropriate hospital, end of story.
That's a month ago, this March?
The middle of March, yeah.
Wow. I mean, I suppose that's good news for Northwell because it means a lot of people who live in this neighborhood who might not normally have gone up to the hospital on 79th Street, 77th Street will now do that, but
So for some of the hospitals, it's helping, and for some of the hospitals, it's hurting, depending on your geography and where the hospitals are. Yeah, it's definitely not as patient-centered as it used to be.
I wanted to ask about something else that I think you talked about with me sometime offline over the phone, which was, are you investigating a model where you're bringing healthcare to people instead of bringing people into the hospital?
So we have talked about that, but we don't have that at this point.
Got it.
And to my comment before, it could help people because maybe the ambulances will get to other people faster. So, yeah. It's
Right.
just an interest, it's different, and
Yeah, well, it's a challenging situation. So can I ask some questions about the closure of Beth Israel and what impact it might have on you guys? Now, I know we talked offline about this some time ago and you were readying for this, and actually we're starting to feel pretty confident that it would be okay. So can you just take me through that thought process, the concerns, how you've dealt with it, and what your reasoning has been, et cetera?
so this we thought was going to happen about a year ago. We put a lot of plans in place that were based on increase in our census and what we would do based on if we had an increase of 5% or 7%. And so those plans sat idle for a year because we saw about a 2% increase in volume over the last year, which is fairly typical that, we would see that type of increase, just people being more aware every year of us being here. And on April 8th, we were informed that the following day, Beth Israel would close. And so they closed their doors on April 9th. Now, we had started to see a fairly large increase in our volume because of the
Pending closure, or no?
because of the EMS policy change.
Okay, thank you.
So we we pulled out that plan just as a volume activation plan and started to look at different things that we had talked about for when we had an increase in volume. But we had seen about a 15% increase in volume as a result of the EMS. About 15%, yeah.
So you've kind of been hit with the double whammy. So there's 2% natural increase because people get more aware, blah, blah, blah. Then FDNY has a new policy and where patients will be brought to the closest hospital, and that increases your volume by 15%. And now, just last week, Beth Israel Hospital closes its emergency room.
Correct.
Have you started to see the impact of that closure?
We have.
And can you share with us what you're seeing, or?
So April is still in the middle of the month, so we haven't finalized our numbers. But between the two factors, we were seeing around 110 patients a day, and now we're seeing around 130 to 135.
So about 30% increase, 30% increase. And how, we talk about saturation rates, absorption rates. How many can you absorb? What percentage can you absorb?
We can continue to add resources and absorb a fairly significant amount more. Still in that, we have a lot of space in our emergency department. And yeah, we feel confident that we could absorb more.
One of the questions I've always had with Beth Israel, we never got answers to these, but from the Department of Health is, the facilities have to show that the closing hospital has to show that other facilities have absorption capacity. And my question has always been, how do you define absorption capacity? If you come to an emergency room, the emergency room stays here, in my experience, have been, delightful. An hour, you see a doctor, it's really fast, it's wonderful. If it goes up to 5 hours, is that considered still okay? What are the outer limits of capacity? How is that defined?
So if you feel on any day that your volume is too high and unsafe, you could request to go on diversion from and they usually grant it for about 4 hours at a time. And that would be usually, you would go on critical care diversion, so the sickest patients wouldn't be brought to you. But typically once, when the city gets really busy, everybody's getting busy, so they don't always grant that. But there's no other definition of when you're at your max. Yeah, and you would just need to make sure that you had operational plans in place to make sure that people are safe.
Can you tell us a little bit more about what is your current capacity in the emergency department? How many rooms, how many people roughly, how long do they stay? And then, so that's question one. And then question two is, do you see any current gaps in your operations relative to the demand that's changing?
I'll answer the second question first. So we have added staffing. We've added more physicians and we've added more nurses and more technicians to our staffing, and that has helped tremendously. So our turnaround times, and we measure lots of different turnaround times, the time from when you walk in till you see a provider, the time from when you walk in till a decision is made about your disposition to release, and we do that for patients that are being discharged home and patients that are admitted, and our times have not changed. It's typically 3 hours, around 3 hours, a little bit under that for a patient that gets discharged home, and about 4.5 hours for a patient that's admitted. And our numbers are still very good according to benchmarks, and they haven't changed. And this increased staffing has helped us be able to meet that need. So, yeah, so we have about, and if you've been to an emergency room, you know that people get creative. So we have 26 private rooms. We have 12 bays with their chairs, essentially. And then when we fill that, then we start going to stretchers in the hallway. We are going to stretchers in the hallway fairly routinely now.
So is that deemed, I guess there's a question to me about where the system makes money and where it spends money, meaning where it's a drain on resources and where it adds to resources. So I presume, for example, having inpatient beds with orthopedic surgery, those are things that presumably bring income into the health system. Emergency rooms, how does that go?
It's usually break even in the emergency room.
And that's because some people don't have any coverage at all.
Mm-hmm.
So when you're at the point where you're putting people in the hallway routinely, do you deem that a pressure, that's a bad day, or that's an okay day, or maybe that's a dumb question? Do you worry about becoming oversaturated? That's a question I could ask.
I think we will continue to add the right amount of resource to keep people safe. And the way I look at it is, the more patients that come to us, the more people we're helping. So, yeah, unfortunately, it means the more people are sick.
Or the fewer places they have to go, not because they wouldn't choose this as their number one place anyway. But we do wonder, what the impact of the closure of a full hospital will be. There was a time when, you wonder, Beth Israel's on East 15th Street, you're on West 13th Street. Are those people going to come here, or are they going to other hospitals, right? If they're going to go downtown, they're going to go uptown. So there's always a question of how many of those people will themselves divert themselves to here. And I think at one point you were thinking that actually it's really Bellevue and NYU that are going to feel the greater impact of the closure of MSBI. But that's a question that we have, of course.
Yeah, I would imagine they're feeling it more than we are. But they also may be seeing less volume as a result of the EM. I don't know what's happening to them on either of these
No, I know.
situations.
Right.
So,
Not your,
yeah.
your,
I mean, the emergency room is one thing, but there's also a different approach now. People don't keep people in the hospital. So, another thing I know you look at is keeping your bed, like you actually want your beds to be occupied, So do you know what, out of the emergency rooms, what like the occupancy rate is on these hospitals? For the longer term beds.
For inpatient beds?
Yeah.
I don't.
Okay.
I don't.
Year or week times?
Definitely. So, and this is pretty consistent.
the question was whether there are times there are periods that have more traffic.
So, yeah, 2 PM to 10 PM, and that's pretty standard, are the busiest times.
I feel like there's questions that I could be asking that aren't coming to me, and I'm just wondering if there's anything on which you think you could be shedding light on that I'm not asking.
I think we're still waiting to see the ultimate impact as well. So we're seeing volume now. It's actually a little bit difficult to figure out what it's a result of. And with more time, I think we'll have more information. But at this point, we're handling the volume with just additional human resource and some additional equipment and
I just have a quick comment. I came here in November of 2020 because I had COVID. I walked over here. I almost passed out on the sidewalk. So really appreciate what you guys do here. And yeah, just want to say that.
No. Here, give it to me. I think we're doing this really for the broadcast.
Yes, you talked about when you need more people, you get more nurses and doctors. Makes it sound as if they're just sort of around, but I read a lot about nurse shortages and doctor shortages. So how do you just say, hey, we're hiring, and they all come? Is that how it works, or how does it work?
well, we had a long time to plan for this. It was part of our mitigation plan. And so we brought on a lot of per diem staff. So we got them all ready to go. People want to work here at Northwell Greenwich Village Hospital. It's a good place to work. And so we have less of a problem than other places have. And we had a bullpen full of people that were waiting. And Northwell also has agency nursing staff. And so we're able to call on those agency staff, if we just need one extra one today. But mostly we use our full-time, part-time, and per diem staff. And we have enough here.
Are you, obviously the physical plant can only hold so many people. It's a certain size. Do you guys have anything in the back of your mind about expanding?
No, not for the emergency department, but we do in our mitigation plan have different uses of space that could help us if we needed to.
Mark, can you just do me a favor and just check to see if any of the attendees would like to ask questions? Can you please raise your hands and we'll just see if there's anyone there? I can't see the attendees. Okay, that's fine. Alert me if you see a hand. What did I want to say? Oh my God. We've met with you guys many times over the years. So there are things that I know, but I feel that some things bear repeating because people who are newer to this, your role in the community might be helped by. So a patient feels something wrong with them. They have to make choices. We were discussing this before. Do you call your doctor? Do you go to urgent care? Do you go to the emergency room? Do you go to the hospital where all your doctors are? and go to that emergency room. How do you make those decisions? So can you help us understand, for example, when one comes here? There was a case on our community board years ago. Someone was like, I went there, my wife had a bee sting. I went to the emergency room and it cost me so much money. And someone else said, well, maybe you shouldn't have gone to the emergency room for that. So if you could just help us understand a little bit the sort of stratifying of like, when do you go where? And you can be casual about it because obviously you're not answering all questions for all people.
Yeah, I think it's actually a really hard question, and it's very personal for people to, everybody has an illness and they take it, I mean, certainly if you think you might be having a heart attack, if you know the symptoms of a heart attack or a stroke, you should 100% come to an emergency department. I mean, I think if you're really concerned about it being an emergency, and you could always call your primary care doctor if you have one to ask them, and they will advise you where to go. Sorry.
In that case, I'll get to another topic that's always been of interest to me with this facility, unfortunately. The question of interfacility transfer. So you come here and you decide, and you come here because you have a pain in your gut, and they determine that you need to actually be admitted to a hospital, but you don't want to go to Lenox Health because your primary care doctor is at NYU, and so you want that whole team there. In my understanding of it, it is much harder for a patient to get from here to Lenox Health, to Lenox Hill than it is from here to NYU. Help me understand this, because I think that one of the snags was that if NYU, for example, if NYU is looking at who they can admit, they have their own emergency room to clear out before they can clear out this emergency room. Is that an issue? Does that come into play?
The time to transfer. So first of all, it's really important that everybody understands that whatever hospital you would like to go to, we will get you there. But it could take longer to go to another hospital. On some days, it could take longer. It really depends, but we have a very streamlined process to get patients to Lenox Hill. And this emergency department is prioritized over even the emergency department at Lenox Hill to get to a bed, because we want to get patients to the hospital, the full hospital, as quickly as possible.
So when you say it could take longer to go to other ones, like what kind of things are
Because
coming
we have to
into
go
play?
through, we have to call, we have to find an admitting doctor there. They have to go through their process to accept, and then we have to arrange for transfer. And a lot of times it's not always, but sometimes it's the receiving hospital that will take care of the transfer, the actual ambulance, where the process that we have in place to transfer to Lenox Hill is very streamlined.
And the process you have, for example, to go to NYU or something else, to whatever, hospital X that isn't Lenox Hill can have snags because on their end, they're not ready to receive you. Or if they're ready to receive you, what about prioritizing an ambulance to get there? Do you guys prioritize patients going to Lenox Hill over other facilities? Like, how does that work? Who gets the first ambulances?
The sickest patients.
The sickest patient. Okay. Good answer. Are there any other questions? Thank you so much. Good luck with your tournament. And also I want to thank you, because I think you're a straight shooter, and it's nice to, good answers from you. But
Thank
we'll
you.
have a lot more answers for you as we go along.
Thank you for
All right,
having
thanks
me.
a lot. We're going to have business session now for a second. I want to know if you guys think that we should write up a resolution on either of these topics.
so. I think they were informative. Yeah, I don't see resolutions here.
Okay, so I disagree. I'm just going to tell you why, and then you can disagree with me. The rat abatement issue, first of all, why aren't they spending money on actually killing the rats? I'd like to know how much money they're spending on telling people that they have to kill the rats and how much money they're spending on actually going into the tree pits. Because most of our homes, unless you have disgusting garbage outside, your home is a bin and a concrete wall. Where are the rats? There's nothing feeding the rats there, right? So, okay, so I'd like to ask for money for, in September, October, when we make our budget requests, I'd like to have a resolution that asks for funding so that the city can actually deal with the rats in the tree pits.
They already do. She said they already do.
But she said that their team is very small. Yes.
Yes, but I mean, I literally read books about how rats are rats. Really, I mean, the whole, I mean, she said the problem, the health risk, the mental health crisis. People are scared of rats, that's certainly true, that's the crisis. She did not say what's a mental health crisis. She said lots of garbage. That's a problem, but it's not necessarily the fault of the rats. Well, I mean, I don't want us to even touch this because I think the city already spends too much time and money on a non-problem when I am very worried about all the real problems that the city has.
Okay, I would like to say, I think it's great that you have that feeling, but rats are disgusting to me. I think that they're disgusting to, but I do think that that's a minority opinion. I'm sorry, Kina. I mean, I do think that if you asked a lot of people in the city if they think rats are okay to just let happen. Okay. But a lot of people believe that.
The question is whether or not what they do now is adequate. Obviously, Keith thinks it's excessive. I don't know how to judge that. You had an issue with your tree pit. I don't think you knew that they would come and take care of it for you, but do we?
They're not going to. They told me, and I mean, well, they told me that I have to fix it or yeah, but the inspector came and the inspector, there's no one said that someone's coming to clean my tree pit.
But they may have done that.
I do think, I mean, I grew up with it. I grew up with rats in the household too as pets, but I do think there are real health issues. I believe that they do carry diseases. I think the bubonic plague is one of the things that was spread by rats. Is that utterly untrue? Mm-hmm. Yeah, we all do, yeah. Over all the other animals. It was yeah, it was the fleas, okay.
I think it, but again, it's a big issue.
That's correct. They can be, but not the ones in the subway. I feel like it might be helpful to get the budget information first and like some of the answers to the questions, and then it can inform how we move forward with like the budget request versus just a standalone resolution. Because I feel like they give very little information that we couldn't have just looked on their website tonight. So potentially in the follow-up, we can get a few more details about the program. Because my assumption too is they're not actually doing any abatements themselves. They're hiring contractors to do it. But I mean, that's not my experience with it, but. Right, exactly. Right, no, right, right, exactly. No, I agree. Sorry, yes, I'm just saying yes on the microphone.
What they're actually, do they actually?
Well, that's why I feel like the budget could be very informative to us of like, what are they spending on just these people that give out tickets versus people actually working to solve the problem. I think it could help to understand the balance and maybe be the inspiration for a resolution in the future.
Well, if that would be another, I mean, I don't have a problem writing a resolution now that says, and then we can decide, we can get that information, and then in October, we can decide we don't want to ask for more money. But I guess my feeling is I've heard a lot of talk from them about what they're gonna do to make people take care of the rats and nothing about what the city is doing.
Yeah, no, I had rats in my yard and I filed a 311 complaint and I got the violation.
All right, should we move on to the other?
Just quickly, I think I don't like rats personally. I don't like seeing them, and I agree with that sentiment, but I'm a little on the fence on the resolution. I do think, to your point, I would like more information because I don't think I really understand how their budget works. But I'm also not like, I'm definitely in support of a budget request, like for sure that.
Question.
Let's say that they come back to us with information and the information says that we're spending X on education and 50% of X on actual abatement. Or, I mean, like, how do those numbers have to change for them to change your feelings? If they say we're spending X on education and 2X on abatement, X on education and 25% on abatement, like, how is that going to change your feelings? That's what I want to know.
I think probably if we found out that like abatement was a very small portion relative to education, then we would probably want to get those closer. But I also don't know how they define education and abatement, right? Is it a contract or is it going out and doing, yeah, but.
Yeah, I guess I'm not clear on exactly what we're asking for them. If we want to be very specific, that we want them to do more work on tree pits, like that's something, but I don't think we can expect the city to take on the responsibility of rat abatement on every block and lot. That's why it's up to the building owner, the restaurant owner, whomever. So what is like?
I think that's okay to ask for more abatement in tree pits, because sidewalks are, there's a fuzzy relationship between the property owner and the tree pit. We own it, but we don't own it. And then she said that actually, if there are rats in the tree pits, that is not the property owner's. It's curious, whatever. I won't go, this is my own beef, so I won't go into it too much, but no, there are some aspects of that are illuminating, which is that how do they tell that there are rats on my property? They see droppings around my completely shut garbage can. Where are those rats coming from? They're not coming from me. They're walking down the street and coming to me, right? So I'm getting a violation. I'm doing everything I can possibly do, right? So but they're not, whatever, they're not. I'd like to see them take care of the rats. But I think the point of the tree pits is a good one. I think your point about limiting it to the tree pits, I think is that's a fair. About tree pits. Okay. That sounds good.
When I look at priorities of the budget, getting rid of rats because people think they're disgusting is not a priority for me at all.
Yeah, no, I'm with you on that one.
Human needs.
That makes sense.
Public education.
Right. Well, it's, budgets are tricky things and you don't know how much it might cost 25 cents relative to $25 to kill a rat versus, reducing a seat in a classroom. I mean, budgets are tricky things.
It's a subway. I mean, I am a little crazy.
Rolling back though, would it be possible to get the actual numbers before we make a request?
Let's hope so. Let's see if they give them that. I mean, I don't know what kind of breakdown they have.
So maybe we should get that.
We'll ask them for that. Okay. And we can't pass a resolution here anyway because we don't have quorum. We need 6. Half plus 1. We're missing, anyway, whatever, whether we have it or not, we have a plan. The plan is we're gonna focus on the treatments, we're gonna try to get the information on the budget before that, we're gonna try to include, okay. To inform already, okay, excellent, thank you. Next question, the hospital, anyone have any opinions about a resolution on that? Because I do. I like. Yeah, I like them too. Yeah, I've come here too. I think what I was interested in for a resolution on this was, it would go to the Department of Health and it would talk about the need for increased, emergency services at Beth Israel. Now, I know it's not specifically attached to this, but concern over oversaturation here. The closing of Beth Israel is really kind of a horrible thing. And the truth is the biggest impact is going to be felt on Bellevue, which is already a nightmare, and NYU, which is already a third world country. But I think any opportunity that we have as a community board to speak out against the Beth Israel closure and ask for more facilities there, I think would be a good thing. Do you think it's? What do you, I know,
I mean, I guess, I feel like it just started and there is no proof now that there is a problem. Like they're handling, it happened April 7th. Things haven't gone to pot. They're functioning just fine. We don't know what's happening at NYU. We don't know what's happening in Bellevue. So we're not going off of, the data. Like
maybe, and also we're seeing Bellevue next month. So, and they're the ones with more impact. So, okay. Okay, I still would love to have a position, but if I can come up with something interesting, I'll try to write it and then you'll see if you like it, and if not, I'll just, well. I think in 6 months we should meet with them again. Yes. No, I think, I mean, we like to periodically check in with them anyway. Also, I would like to say something else. So I have been pushing ineffectively because I don't seem to go to any of the right places for a follow-up community health impact study. So when St. Vincent's closed, there was a community health impact study done, survey done, and it was paid for by the developers. I have to look at it again to see exactly, but I think that there would be enormous value in a follow-up study that essentially is the same thing 10 years later. This thing has been operating now for 10 years. Is it an excellent model or is it not a good model? And we don't have an answer to that because where are you going to go to find that answer? No one's done a follow-up study. So I might like to use this opportunity to ask for that. Would you be okay with that? Well, I also feel that they have a lot of money. I mean, of course, it's a little tricky because there's a conflict of interest question. They'd have to step away. What? No, of course not. But I mean, a study costs $90,000 to do. That's not very expensive. We'll take it from the rats and give it to the. All right. Well, actually, I would like to see it. Well, yeah, there's so many different studies that you could be doing. I mean, I'd love to see one that monitors the success of this model, which is this was the first standalone emergency department in Manhattan. There are many of them around the state. There was one in the Bronx, Montefiore, and now there's one in Brooklyn, but this was the first in Manhattan. And so it's really a new model for Manhattan. And I'd like to see if it's a good model or not. Are people getting what they need or not?
Beth Israel, I only went there once. Great. I guess this was Saturday at like 10 a.m. I was in the house. There was nobody in the waiting room. Yeah, when I went this summer, it was an empty waiting room.
I was here twice in the last 6 months and it was good, this place. you know, and I live way downtown and I said, no, we're taking a lift. We're not gonna go.
Parents' aide fell down the stairs in her house on Bleecker Street and so called an ambulance. The ambulance doesn't come here because they don't do trauma, and went to Bellevue. And Bellevue was like what you see in the movies. It was like people in the hallway, people screaming. It was like, wow. She got excellent care. She did. She got excellent care, but there was a lot.
Maybe, and maybe because, you know, I think you're thinking about this like a lot more holistically, and I'm wondering if we could have DOH come give some holistic stats. Oh, and they're,
We had a meeting planned actually with DOH, but then there was a lawsuit that was initiated against DOH, and so DOH obviously stopped talking to us. But they were pretty reticent to come talk to us anyway. You know, there's been a lot of flack about why the hospital was being allowed to close, and there was a lawsuit, so there was a temporary injunction, and blah blah blah. And now they finally won the closure. So there have been meetings with elected stuff with DOH, but yes, I agree with you. And it is something that. Okay, but having dealt with it. Have you been in touch with the community board? It was about.
CB3, is that?
I was, well, it will, in the sense that if you, it will, yes. The emergency room gets that. I mean, and also with, I don't know anything about the hospital industry, so are there too many beds? I don't think one thing that really, I think will happen is that there is now one for, psych emergency. That is really separate. Bellevue does. You doesn't. They don't. Yeah, but that's different. That's different. You know what I mean? Like, you, and so, I mean, we have a lot of people.
You know, I actually have been around this committee. I think it's been super. Yeah. It's not always everything, but it's wonderful. Anyway, we shall see. All right, guys. Thank you all for your input. And I like that. We can kill. Thanks, everybody. Good night.